Let me do. Let. Good morning, everyone. Thank you, Femi. How are you? Good morning, everyone. Sarah, how are you? Good morning, Olubumi. Good morning, Femi. Glad to see you back. Glad to see you all back. Glad to see you back. hmm Let's wait for the others to join, okay? If you join, then you share to you like today's session. Click on the like. Yes, click on the like. Click on the like button. Mhm. I'm doing well. Yes, bet. Like and share. Good. Let's wait for the others to join, okay? So today we are going to do clinical judgment. Okay, thank you. Mm-hmm. Clinical judgment. Do I have all the ATT guys on board? Mm-hmm. Yes. Good morning, everyone. Let me know if you can hear my voice. Okay. So check your mic. Let me know. Type in the comment section if you can hear my voice. Okay. I want to know if you can hear my voice. So let me hear from the comment section, please. Mhm. Let me know if you can hear my voice. Yes. Let me hear. Let me know from the comment section if you can hear my voice. You can hear me. Okay. Yes, another person. Let me know if you can hear my voice. Yes, I am. Juliet, how about you? I am doing great by the grace of God. Mhm. Good. Let me hear. Don't rely on what someone is saying or just typing. Let me hear from your angle where you are. If you can hear my voice, okay. If you can hear my voice, right? We're not gonna spend much time. I want to explain clinical judgment to you. We do some few questions and we say goodbye. Okay. So those on the ATT page, we are going solely for the curriculum. Okay, we have done a lot. We have done physiological adaptation. We have done psychosocial integrity, basic care and comfort. We have done the session A. Is left with the session B. Okay, today we are going to do clinical judgment. Clinical judgment takes about 5 or 6 topics, 6 topics in NCLEX. So you should know how to answer those questions. You should be able to identify that this is a clinical judgment question. Okay. Yeah. Yeah. So and we've also done psychiatry too. Good. So let me start sharing. Okay. Let me start sharing. Right. So clinical judgment. Right. So this is clinical judgment for today. Clinical judgment. Right. So our learning objectives for today, by the end of the lecture or the session today, we are going to be able to define clinical judgment, okay, and explain its importance in safe nursing practice and what NCLEX success. Define what is a Q and distinguish between relevant, critical, and irrelevant client information. Identify the 6 areas of the clinical judgment model and differentiate the purpose. So all these ones recognize significant findings from assessment data, and the rest analyze related cues and identify patterns and determine the client's most likely condition. Prioritize client problems using urgency, likelihood, safety, ABC, and risks of harm. Generate appropriate nursing interventions and expected outcomes for priority problems. Select the safest and most effective nursing action, okay, in emergency. Then evaluate the client's response, okay, to treatment and determine whether the care should be continued, modified, or escalated. Then apply all the 6 clinical judgment skills to unfolding NCLEX case studies. Then distinguish between recognizing cues and analyzing cues, prioritizing hypothesis, taking action, and generating solutions. Okay. So let's start. What is a cue? A cue is any piece of information, any piece of information about a client or a patient. Okay. That helps the nurse understand the client's conditions and make a clinical decision. Yes. So if you go to the hospital, you speak to the nurse and you tell the nurse your problems and why you came to the hospital. We do your vital signs. We do our laboratory investigations. We do our scans, CT scan, MRI, every scan, Doppler, USG, all these imagings or radiographs. Okay. All these informations help the nurse understand the client's condition, and based on that, help the nurse to make a clinical decision. Okay. So in simple terms, a clue is about what may be happening to the client. Okay. We have 3 types of clues. And in NCLEX, you're going to find these 3 types in your exams. We have relevant clues, critical clues, and irrelevant clues. Okay. So relevant clues are clues that are connected to the current problem. Okay. So if you look at the S bar, we have the S bar like this. S bar. We have the situation, the background, the uh, the assessment or whatever, and the response. Okay. Yes. So the current situation of the problem, the NCLEX will give you the question, the diagnosis, the current diagnosis of the patient, okay, and give you a clue around the diagnosis. So relevant, okay, these are the problem, the signs and symptoms or the information that is connected to the current problem. Example, they can give you hypertension, okay, as the diagnosis, okay. Then they give you the signs and symptoms. So the signs and symptoms of hypertension is headache, okay, high blood pressure, high BP, okay, yes, dizziness, or lightheadedness, all these ones. So all these are connected to this problem. Then we have another type of clue we call the critical clue. These clues, among these ones, we have immediate danger. We have some clues that is going to pose immediate danger. Okay. So persistent headache that is on relief with medications. Mm. Then we have nosebleeds. Okay. Nosebleeds or severe abdominal pain, or clues that says that there is life threatening about, or the patient is in serious danger, that if you don't act on it, the patient is going to die. Okay. Yes, so we always prioritize that one. Yes, the relevant are the ones you are going to what select. Then the out of the relevant, you identify the critical. Okay. Then we have another type of clue. We call it irrelevant clue. These problems does not meaningfully relate to the current. Okay. So you do not select it when you are making your selections in the exam. So example, with this case of hypertension, they are giving you the signs and symptoms in the question. They can say that the patient wears glasses. The patient uses bottle to urinate. Okay. Or patient uses walker to walk. How does this relate in physiology? How does this relate to hypertension? Okay, the person has what? The person was diagnosed, or the person underwent, let's say, eye surgery 2 years ago. Okay, how does this relate to hypertension? So it is a clue, although, but it is what? Unrelated or irrelevant clue. That is what I want you to know. So in the question, you will find all these three. Hmm? Yes, there are some questions depending on the type of question you will meet. But I want to take the pain to teach you this so that when you see it, you will not be surprised. You can find a question, you can find a question that has only relevant or critical clues. Yes, they can give you a question that it has only relevant or critical clues. Okay, yes. Or you can find a mixture of all the three. So, like this one, I give you a mixture of all the three. Okay. Always remember, always look for the relevant clues, select it, then analyze the relevant clues, which one is critical that can easily pose danger to the patient. Okay. Yes. So these ones are the ones you should know. Okay. So under clinical judgment, we have 6 cognitive skills that they test for. They test for your ability to recognize the clue. They test for your ability to analyze the clue. They test for your ability to prioritize hypothesis. Okay, that's prioritize the clue. Mhm. They test for your ability to generate solutions. Okay, so before, remember we have the art pie. They have changed the art pie now. The art pie is gradually fading out. We are getting new synonyms. Okay. So before we were calling it what? Planning. Now it is called what? Generate solutions. Okay. Yes. So all these ones, recognizing clues is for assessment. Okay. Assessment. Then analyzing the clue, diagnosing using the nurse's diagnosis or whatever, okay, the medical diagnosis. Then take action is now replacing what? Implementation. Okay, yes. Then evaluation still maintains, but they've added outcomes, evaluate outcomes. Yes. The two most important ones that they will test you on is these two guys. Recognizing clue and analyzing clue. So as you move down, you will be able to understand them. Okay. Yes, and how to identify them. Okay. Now let's continue. How to identify the clinical judgment area. The main trick is that when you see a question, do not classify the question by the disease. They will give you a question on hypertension, diabetes, okay, or seizure. These are the disease, these are the diagnoses. Don't look at only the disease, okay? Rather, classify the question by what the question asks you to do. Yes. So if you want to use the S bar, the question will give you the situation and give you the background. Okay. The background. Okay. And they will give you the all the assessments or whatever. Okay. That they will give you. But when they finish giving you all these informations, the question will now ask you, what is the next action? What is the next implementation? Which one should the nurse do first? This is where that is the most important part of the question. So you classify the question, the scenario by what the question asks you to do with the information they have given you from the situation and the background. Okay. Yes. So we can use same client scenario to produce all questions in all 6 areas. Okay. So areas like recognizing clue, they are just merely asking you. The question is asking you that which of the informations is important, the vital ones. Okay. Yes. So you ask yourself, these are the simple questions. Which of them matters most? Analyzing clue, we will go deep into that. Analyzing clue is the question Nclex is just asking you, explain or connect the information. So let's say hypertension is the center. So they will give you plenty signs and symptoms, headache, okay, fever. They will give you dizziness, okay. They will give you how do we call it? They will give you leg pains. Okay. They will give you anorexia. These are all what signs and symptoms. Okay. But you ask yourself if you want to look at the recognized clues, you ask yourself that, okay, the person has given me a scenario of hypertension with all these signs and symptoms. Okay. Which one is important? All these are clues. But among these clues, which one are important? I'll take headache. I will take dizziness. Okay. I will not take fever. I will not take leg pain. I will not take anorexia because they are irrelevant. They can tell you patient wears glasses or uses walker to walk. Is it relevant if we give you physiology? Can you relate it that a person who wears glasses can get hypertension? In the physiology of hypertension, is there anything that says somebody who wears glasses gets hypertension? Can you relate? Okay. Yes. So analyzing the cues helps you to connect these signs and symptoms to the hypertension. Okay. That simply we say that what does it mean? Then prioritizing hypothesis. Okay. Now I have what? The ones that were important to us in this case of hypertension were what? Headache and dizziness. Okay. So among these two, which one will you prioritize? Dizziness and headache. Okay. Then so that's where the priority comes in. You prioritize it because if you don't know which one you prioritize, you delay treatment. You delay treatment. Okay. Please, why not take fever? Can you explain part? Okay. Every patient who gets hypertension, do they get fever? Say why? Okay. A patient with hypertension with sepsis will get fever. But does all patients who has hypertension get fever? So the fever that was added to it is irrelevant. It does not explain the question, the diagnosis. Okay. Yes. So it makes the fever irrelevant statement or irrelevant information. That's why I took the pain to what explain this to you. The relevant, the critical, and the irrelevant. Okay. Yes. So we will get to all these ones. Okay. So we know how to prioritize. You know how to prioritize this. So the headache and the fever, you ask your them, is any of them A, B, C, D? Is headache this? Is this one dizziness? Is that about circulation? Okay. Is there C? Is that about breathing? Okay. Is headache and dizziness? Which of them falls under circulation? Okay. Then it goes like that. Aha. So you and the D, the disability, okay, with pain and all these ones. So you realize that if you want to prioritize, you prioritize the circulation aspect, the dizziness over the headache. So if I start treating, I will treat the dizziness first. So I've been able to prioritize, select the most urgent problem. Okay, so now that you have selected your problem, these three is simple. Every nurse in this world can do because you jump on the add pie, the add pie. Okay, now you are generating solution. How do you plan for somebody with dizziness? Okay, how after your planning, you act on the planning. Okay, then you implement. Aha. So we planning, you see, put the patient in what? Trendelenburg position, like this. Head down, leg up. Okay. That is the planning. Action phase, implementation phase. The patient has been turned upside down. Okay. With head down, then evaluation outcomes. You ask yourself that when you turn the patient upside down, has the dizziness resolved or not? So you decide whether the treatment worked or not. Did it work or not? This is all about clinical judgment. So let's take it one by one, okay, with clinical examples. Then you understand. We aren't going to spend much time today. It's only 19 slides. Okay, good. So the first one, how will you know that this question I'm answering falls under recognizing cues? How will you know? Because if you don't know the question, eh, you will not know the trick to answer it. Okay, you should be able to know the question. That is why they said that don't only look at the diagnosis. Where is my listing? Where is the point? Mhm. Don't only look at the diagnosis. Yes. Do not classify the question by the disease or the diagnosis in it alone, but classify by what the question asks you. Classify which class does it fall under. That this is a recognizing clue question. This is a hypothesis prioritization question. Okay. Classify the question by what the question is asking you to do. Okay. So how will I know that this is what a recognizing cue question? The first is they use certain phrases, and I'm going to run you through all of them, and you ask yourself that have I seen any question in this format before? So when we say when you are treating or you are dealing with recognizing cue, you are gathering information. Okay. Then you ask yourself this information, which one is relevant, which one is not relevant, which one is critical. You group them. Okay. So most of the questions asks you to identify important, relevant, if it is lab results, which one is abnormal, okay? If it is other deterioration question, which one is changing the client information or health? So the question will come in this form. They will give you a long scenario, and they will end it as what? Which finding requires follow up? Findings. Okay. Which findings are significant? So they will give you plenty findings. Which one is significant? Okay. Tell me you've not seen this before. Which findings should concern the nurse? Which findings should concern the nurse? They are asking you for information. Then which finding is relevant? Okay, these are the questions you should ask yourself. Okay, which findings should the nurse report? Okay, to the doctor. Which assessment? Sometimes they will add assessment to it. Assessment find meaning they are being friendly with you. They want you to answer this question and get it right. Okay, sometimes they will delete. Most of the time, they will delete the assessment and bring only findings. Which findings require immediate attention? Okay. Which information, sometimes they will change grammar. Okay. Should the nurse obtain? Identify the findings that require further assessment. So these are the type of questions, phrases you'll be seeing. So, what are we doing? In this recognizing cue questions, you are collecting or selecting data and evidences. You are not yet diagnosing the problem. We are in the assessment phase, okay, or selecting the treatment with planning or whatever. You are still in the assessment phase. So you are gathering data. So when you get the question, underline the data in it and ask yourself, does this data explain which one can easily kill the patient if I want to use my Amasa or my ABC? That's it. So example, they can say which findings require immediate follow-up. This is recognizing cue because you are selecting important findings. Okay, there is a trick here. If you get confused, if the question says look at the chart, they give you a chart and they say look at the chart and pick the important information, think that they are asking you about what? Recognizing cues. How will you be able? What are the sources? What are the areas that you can use to gather information? In the question, you can see information from vital signs. Which of the vital signs is abnormal? Normal. Okay. Signs and symptoms and complaints of patients, if they are hot, alive and active, alert and oriented. Physical assessments that you did, objective data. Yes, you saw data. Patient's body is warm to touch, whatever. There is a bluish discoloration of the skin and all this one. All this, yes, you the nurse have seen it. Laboratory investigations will bring you what information. Diagnostic results will bring information. Medical history can cause a relation. Medication the patient is taking and changes from baseline, the norm of the patient. Then information from family members, the patient's husband, the wife, the child, the granddaughter made a statement. They are all information. So you have gathered all these informations and ask yourself that which one is important. Okay. The important ones is what we call the relevant. So NCLEX will ask you which of the assessment findings require further assessment or requires should the next report. Okay, which of the assessment findings should the next report? Among this data that you collected, which one is relevant? The relevant ones are the ones that we will report. That's it. And among the relevant, if I want to place it in the order of hierarchy of severity, okay, which one will come first? Which one will come second? Which one will come third? Which one will come fourth? That's it. That's it. That's it. Okay. Yes. So, example, a client with dyspnea, crackles, oxygen saturation of 86, and pink frothy sputum. Okay. They have given you this clue. 1, dyspnea. 2, crackles. 3, oxygen saturation of 86. 4, pink frothy sputum. Remember, I told you something that sometimes they can give you all the information will be relevant. Okay. If you get questions like that, do cross. I love questions like that rather than they mixing it with relevant and irrelevant. Because if we tell you, if we tell you, yes, so if we tell you or we ask you, these are significant cues suggesting pulmonary edema. Okay, pulmonary edema, let me use EPE, not embolism, PE, has dyspnea. Okay, yes, the lung is filled with water. Can oxygen pass? No. Can carbon dioxide come out? No. Patient will be having difficulty to breathe. Okay, dyspnea, we have been able to explain. Crackles, if I do auscultations, will I hear water at the basis of the lungs? Yes, crackles. Okay, explain. How to happen to my, will my oxygen saturation in the blood drop? Yes, because oxygen cannot go, so it will be dropping. Then pink frothy sputum. Yes, there is fluid here, there is mucus here, blood vessel capillaries will be rupturing. Okay, so patient will cough it out and you will see it as what? A frothy sputum. A sputum with what? Air bubbles. So does all these ones explain pulmonary edema? Yes. So they are important. All of them are relevant information. Now, we say prioritizing, so you have been able to recognize your cue. Okay. But if we say prioritize these guys, now you come and ask yourself that which of these signs and symptoms fall under A, airway? Which of these signs and symptoms fall under B, breathing? Which of these signs and symptoms fall under C, circulation, and D? So you measure the ones that fall under A, okay, is the one that you start first. So is there any airway blockade? Okay, yes. So these are the things that you do. Okay, that's the trick. Okay, sample question is here. We have a patient, a client with heart failure. You see, they have given you the disease, who report increasing shortness of breath. Which findings require immediate follow-up? Which findings require immediate follow-up? So look at these questions. Look at these answers. Oxygen saturation decreasing for what? 95 to 88. Weight increase by 2.3 kg in 48. Okay. Potassium level of 4.1 milliequilibrium. New bilateral crackles. Urine output is 20 mils per hour. Okay. Heart rate is 82 beats per minute and ping 40 sputum. Try this answer. Before I bring out the answer, try. Shoot your answer. Yes, we are analyzing. This is recognizing what cues, sample question. So send me your answer. Let me see. Yes. Which a client with heart failure reporting increasing ing, shortness of breath. Now the follow-up question says which findings require immediate follow-up? Select all that apply. Yeah, shoot. Let's go. Okay, so I will send you my number. Okay, good. Yes, shoot. Increasing ing. Okay, so which of these tells you that there is a worsening, a worsening what heart failure? Heart failure is ongoing and it is causing the patient to have what? Worsening, ongoing, and increasing shortness of breath. You have given whatever you want to give, but still patient is complaining of shortness of breath and that he is crashing. Which findings require immediate follow-up? Yes, shoot your answers. Shoot. Yes. Okay. Good. So let's take it one by one. Okay. Let's take it one by one. Oxygen, somebody with heart failure. Okay. Or somebody with heart failure who is having or increasing or worsening shortness of breath. Okay. Oxygen saturation decreasing from 95 to 88. Yes, this one is part. Okay, because physiology can explain. Good. Weight increase by 2.3 kg in 48 hours. If you choose this answer and we ask you to explain, can you explain? Yes, they are retaining fluid. So in physiology, okay, heart failure patients retain fluid and their weight increases. So physiology can back this. So we will choose it. Okay. Potassium is what? 4.1. Heart failure. What is done? You ask yourself when you see laboratory investigations, always ask yourself that what is the normal levels of this lab investigation? Okay, so the normal level of lab investigation is what? 3.5 to 5. Is this relevant? It's an informational, but is it relevant now? No. Okay. No, it's not relevant. Okay. Looking at the scenario and the situation ongoing. Okay. Good. Now let's look at the D. Heart failure with fluid accumulation all over. New bilateral crackles, yes, is relevant. Then urine output, the E, is what? 20 mils per hour. Yes, we can explain. Okay. Yes, heart is not pumping blood out. So the kidneys are not getting blood. Okay, that physiology connects. So the kidneys doesn't have much to what excrete out. So urine output will reduce. Okay. Yes. So this is part. Then heart rate is what? 82. Okay. So the same thing you did for the labs, do the same thing for the vital signs. Ask yourself that what is the normal heart rate of an adult? Hmm? Normal heart rate of an adult is what? 60 to 100. So is this normal? Yes. Then it is not a serious concern now. Pink frothy sputum, fluid accumulation, blood pressure will surely shoot. Okay. So what? Capillaries will burst. They will mix with the sputum. Patient will see it as a foreign body, cough it out, and you get what? Mucus with bubbles, air bubbles in it. Yes. So we have what? A, we have B, we have D, we have what? G and E. Okay. So after gathering this information, these are the relevant informations with this guy. You ask yourself that among this, which one is what a priority for me? That is why you come and use the A, B, C, D to fish them out to help you with what prioritization. Okay, good. So let's go to question 2. Answer question 2. Question 2, yes. A client is admitted with suspected sepsis. This is the question. Which findings is the most concerning? Yes, suspected sepsis. Yes, shoot your answers. Yes. Number 2. I want to know whether you understand the journey we are making. Yes. Number 2. Which finding is the most concerning? Suspected what? So we are recognizing Q. Please send your answers to the chat box, not to me privately. Okay. So this is what recognizing Q. Okay. But the question wants to know which one is a critical. Okay. Understand the concept to you gather your information. Ask yourself, well, A, if somebody has sepsis, we are suspecting sepsis. Okay. And the A, A, temperature. You okay, good. You send your answers. Good. Remember the relevant, the critical, and the irrelevant. Okay. Yes. Yes, I like your answers. Good. Good. Even if I will explain to you, okay, when you are gathering data, ask yourself which one is relevant. Okay, so the center of focus is sepsis, suspecting sepsis. Okay, so temperature 38.3 is relevant. Heart rate tachycardia is relevant. Blood pressure decrease from 84 to 48 is relevant. White blood cell count of 14, which is high, it's above 10,000, okay, is relevant. So all of them are relevant. So you have a question with all the options relevant. Now you go to the second one, the critical, okay. Temperature of 38, can it kill a patient? 38 point, can it kill a patient? No. Heart rate of 108, can it kill this patient? No. Blood pressure decrease from 112 to 184 over 48. This is a pure clinical this thing of what? Hemodynamic instability. So this drop can kill a patient, yes. White blood cell count of 14,000, only 4,000 above 10,000, it is not critical lab result. Okay, so C becomes what? The most concerning. You have gathered your data, okay, they are all relevant, okay, but the most of the relevant. So if you start tackling this patient, if you start treating this patient, you will start from the C, addressing what? The blood pressure. Please, do you understand? Yes. Good. Now, question number 3. If you know, use this trick I'm showing you. Question number 3. Let's go. A client is taking digoxin. A client taking digoxin reports nausea and weakness. Which additional information, this is the question, is most important for the nurse to obtain? Question number 3. Send your answers. Yes. Yes. I'm seeing good answers there. Good. Yes. So all of you got it right. Okay. Yes. So if you look at this one, you see when I show you this one, now the third question, you are blowing it. Okay. Yes. So a client taking the dozen can report nausea and weakness. Okay. So all these factors, the B stands out. The client's apical pulse and potassium level is very, it can easily kill the patient. So that's the most important information among them. Okay, good. Now let's go to analyzing cues. Now you know how to gather the cue. Okay, let's analyze the cue. Okay, so analyzing the cue, what you have to ask yourself is, what does this mean? What does this mean? What does this mean? Okay, what does this mean? I have been able to fish out the relevant and the critical. What does it mean? Okay, so when you see questions like that, the question always asks you to connect that relevant and the critical findings, or the problems that you identified. Okay, is there a pattern or determine What the findings suggest or mean. Okay, so this question that you saw, I want the question that came with this question that we saw, a person with heart failure, with shortness of breath, and all these ones. So this one will be out, this one will be out. So among these four, one, two, three, four. No, this one is out. So among one, two, three, four, what does it mean? Can I explain it? Can does it relate to heart failure? Yes. The last question you did, somebody taking digoxin, you pick what? Apical pulse and potassium. So digoxin toxicity. Okay. Digoxin toxicity. Apical pulse. Okay. And what? K levels. Can we relate? Is there any physiology the books are saying about the digoxin toxicity? Can we relate it? So what does it mean? Okay. Yes. So in the questions, you will be seeing phrases. Phrases. Oh, phrases. I've told you that the last ending of the question, the phrases is the most important part of the question, not the scenario. The scenario will help you to identify the clues. The phrases is the most important thing. So you do a lot of kill banks and you have seen these phrases a lot. So how should the nurse interpret these findings? You've seen questions like this. Okay. They sometimes some of the questions too, they will put this phrase there. Which condition is most consistent with the findings? Sometimes you get a question that they will put this phrase in it. What do the findings suggest? Okay. Now you get another question, they will put in phrases like this. Which findings support the suspected condition? You find questions with which cues are related. Okay. This one doesn't normally come because it's too cheap. You easily get the answer. So they will confuse you. This one like this, you see it a lot because they use grammar to confuse you and you'll be sitting down, waste all the 2 minutes on that question. Which condition is the client most likely experiencing? Yes, you see kill banks and questions like this. Then which explanation best account for these findings? So they will ask you questions that will what you should be able to use your clinical, okay, your cognitive skill to link it with the condition they've mentioned, okay, or which findings are consistent with the findings are consistent with which complication. Yes. So what are we doing here? Yes, you already have the cues from recognizing the cue. You already have. Now you are connecting those cues to understand the client's condition. That linkage. It is one analyzing cue and recognizing cue. It is one area that fails a lot of people. Okay. It is one area that worries a lot of people. If you are not able to identify cues and you are not able to link the cue to the diagnosis or the problem or the complication, you are in big trouble. Let's look at this example. A client has severe hyperglycemia. Okay, this is the diagnosis or the problem. But remember the rule. The rule says that don't classify the question by the diagnosis. Classify the question by what? The phrase. Okay. Yes. So severe hyperglycemia H. Okay. And they give you the signs and symptoms. This guy has what? Increased serum osmolality. So serum osmol, OSM, is there. There is what? Confusion is there. and there is no ketones, is there. If you combine these three, does it relate? If somebody has hyperglycemia, will their blood become thick? Yes. So osmolality is explained. Would they be confused? Yes, CNS can get involved. There is confusion. Okay. Can we get a hyperglycemia patient who has no ketones? Yes. Okay. So this one helps you to what? We will say that what? Yes, the condition is consistent with what? The findings. You have analyzed it and say the findings. Now, if they want to play tricks with you, sometimes they will ask you which condition is consistent with these findings. They will do the reverse. They can give you the signs and symptoms and give you that which of the following conditions is consistent with the above findings. Or then sometimes they can give you the signs, the condition and the signs and symptoms, and they tell you which nursing interpretation, okay, is consistent with the above scenario. They want you to interpret what you are seeing. Yes. So this is analyzing Q because you must connect the findings with what? Identifying HHS. In HHS, there is no ketones or minimal ketones. We did it last time. Okay. So the trick is if you must say, when I put this finding together, they mean when you read the question and the only thought that is coming through your mind is, when I put all these things together, what does it mean? It means that you are solving what? Q analysis question. Okay. So analyzing. So sometimes what do these findings consider, whatever? Let's look at this condition. Example, crackles, hypoxemia, and pink sputum together indicate what? Fluid accumulation in the lungs rather than simple anxiety. So you see, sometimes they can give you the signs and symptoms and they give you, okay, which of the following conditions, okay, is consistent with what? The above findings. They will give you what? Pulmonary edema. They will give you anxiety. Okay. They will give you what? Hypertension and all these ones. So you should be able to what? Connect that connection ability, the power should be there. Okay. And you can only do this when you have what? 100% power on physiology. Okay. It will be very stressful that you have done well with psychiatry, you've done well with basic care and comfort, and clinical judgment fails you. And because of that, you have to come and pay money again for what? ATT. Pay money again to register your Nclex. Buy tickets in and out to fly to another country to write Nclex. Okay, you spend close to $1,000 because of clinical judgment that you failed. Okay, good. So let's look at possible findings and sample questions. So analyze these sample questions. A client with diabetes has the following findings: blood glucose 624, arterial pH or pH of the arteries 7.36, serum bicarbonate 23, serum osmolality 340, negative serum ketones, increasing confusion. Which condition? You see the question, they've changed it. Which condition is most consistent with these findings? Yeah, shoot your answers. Sharp. Who is this. Yes, shoot your answers. Mm-hmm. 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 I'm waiting for your answers. Mm-hmm. Mm-hmm. Good. So you see, when you analyze, if you want to take it one by one, okay, you realize that what the HHS hyperosmolar hyperglycemic state, okay, yes, because we have negative ketones can explain this, okay. There is confusion in this. Blood will become thicker. Osmolality is above 300, so blood has become thicker. If it is below 300, blood is thinner. Okay. Sodium bicarb, good. And this one, arterial pH. All these ones are consistent with this guy. Okay. So you know your answer now. Let's go to question number 5. A post-operative client has sudden dyspnea, pleuritic chest pain, tachycardia, and an oxygen saturation of 87. How should the nurse interpret? You see the question? How should the nurse interpret these cues? Mhm. So, interpretation, you ask yourself, so if I connect all these ones, what does it mean? Mhm. This is what cue analysis question. Okay, yes, shoot. Question number 5, shoot. Yes. Sudden dyspnea post-operative. Good, good. Number 5, good. Yes, good. Shoot your answers. Good. Right. Yes. So let's analyze. These are the signs, the cues they have given us. This client is a post-operative client. He has sudden dyspnea, pleuritic chest pain. This alone should answer your problems. There is tachycardia and oxygen saturation is dropping. Okay. So we have 1, 2, 3, 4 cues plus this 5. How should the nurse interpret this? So they are asking you what is what the the Q analysis here. The first answer says they are consistent with post-operative atelectasis. If your lungs was like this, they are alveoli, and today it has closed to become like this, will you have pleuritic chest pain? Yes or no? No. So A is out. Yes, post-operative client can have what? Their alveoli closing. But the fact that your alveoli closed does not mean you are going to get pleuritic chest pain. So it's out. Okay, A is out. B, pulmonary embolism. Because they are lying down, they can form clots. Okay, even patient on the ward admitted for so many days can form clot. Clot has block here. No carbon dioxide is going. CO2 is oxygen 2 is not coming down. Yes. So all these ones can hurt. There is pleuritic chest pain because fluid accumulation. There can be tachycardia, oxygen sat will drop, and there is sudden dyspnea. So it's consistent with it. Opioid induced respiratory depression. There is no pleuritic chest pain. And what general anesthesia, there is no what pleuritic chest pain. GA, you will not get what tachycardia, okay, or you will not get sudden dyspnea. So the B stood out. Okay, question number 6. Question number 6. A client has the following findings: sodium is 118, low serum osmolality, concentrated urine, high weight gain, and no peripheral edema with increasing confusion. Which interpretation is most appropriate? Question number 6. Shoot. Low serum osmolality. Yes, question number 6. Shoot. Mhm. Mhm. Yes. Yes. Question number 6. Yes. Okay. So I have a body, and a blood vessel. Okay. Inside the blood vessels, sodium is low. What is causing sodium to be low? It is two things. Either I am bringing all the sodium out, or something is diluting my sodium. Okay. So don't rush to conclude here. Good. Let's look at these conditions and relate. Client has what? Diabetes insipidus. They urinate a lot. Okay. Yes. So what? The specific gravity or the concentration of the urine is what? Is is low concentrated urine. So this one is out because this patient has what? High concentrated urine. Okay. So A is out. Then the B, the findings suggest SIADH. Okay, syndrome of inappropriate antidiuretic hormone with dilutional hyponatremia. Yes. So I am accumulating a lot of fluid in me. Okay. So it has come to the bloodstream to dilute the sodium. That is one. Okay. When it dilutes, you see that what the concentration of the blood will also go low. So osmolality is low. This one they did not give you value. Okay. But if they are giving you value, the value will be less than 300. That's the trick. Know it. They are because water or fluid is not draining out of the body but getting soaked inside the body. The urine will be concentrated. Yes. Are they going to gain weight? I'm accumulating weight. Yes. Water. Yes. Water is weight. No peripheral edema. Yes. Okay. In the initial stages, there is that relation there. Then increasing confusion. Yes, water will flow because sodium is low here. So the cells what pull water, osmosis. from a region of lower concentration to a region of higher concentration. Okay, until what? No, this one is not until. So the brain cells will soak water in them, and the patient will start what experiencing confusion. So the B stood out. Okay, good. Now let's go to what prioritizing hypothesis. Prioritizing hypothesis. Okay, yes, this one. Which you ask yourself, which problem comes first? Which problem comes first? Okay, so the question asks you to select the most likely, urgent, and dangerous client problems. Good day, Miss Everest. How are you? So, urgent or dangerous client what? Urgent or dangerous client problem. You are prioritizing. You are prioritizing. Now you know how to fish for your problem. You know how to link the problem with the diagnosis. Now, the problems that you saw, which one comes first? That's it. Which one can easily kill the patient? Which one is A? Which one is B? Which one is C? Which one is D? Okay. So the questions mostly end with certain phrases like which problem is the priority? Which hypothesis should the nurse prioritize? Which client condition is most concerning? Which complication presents the greatest risk? Which nursing diagnosis has the highest priority? Which client should the nurse assess first? Which potential problem requires immediate attention? Okay. Then which explanation is the greatest concern? What are we doing? We are ranking the problems according to urgency, likelihood, and risk to kill a patient. So over here, remember we had relevant, okay, and we have critical. In hypothesis prioritization, we are dealing with only the critical cases to treat them first. Okay. Example, a client with what? Myasthenia gravis has what? Dysphagia, weak cough, and shallow respiration. Which problem has the highest priority? So dysphagia, swallowing, weak cough, and shallow respiration. This one falls under A, airway and breathing. Okay. Yes. So I will definitely prioritize the shallow before I come and think about cough, giving the person cough machine to help the person cough. And before I come and think about swallowing problem. Somebody cannot breathe. You want to treat swallowing over breathing? No. Okay. Yes. Because this clearly shows that there is an impending respiratory failure. Okay, so you always rank the problems according to their priority. So they have listed this: airway, breathing, circulation, acute neurological changes, your safety, actual before potential, unstable before stable, acute before chronic, unexpected before expected. So in simple short, your AMASA. Don't go and look for that slide. Okay. Amasa. If you know your Amasa, prioritizing hypothesis, you are done. Okay. So questions, sample questions. Let's shoot. A client arrives with crushing chest pain, diaphoresis, and nausea. The EKG shows ST segment elevation. Which hypothesis should the nurse prioritize? Question number 7, shoot. Are you going to do A, B, C, or D? Crushing chest pain, sweating, diaphoresis, and nausea. Which hypothesis, which of these cues should you prioritize? Okay. Mm-hmm. Mm-hmm. Good. So the B, acute myocardial infarction causing impaired cardiac perfusion. Good. Number 8, a client with myasthenia gravis developed difficulty swallowing, weak cough, and shallow respiration. Which one has the highest priority? Everybody knows that what? Okay, you answer this question. I won't talk. Number 8, yes. Number 8. Mhm. Which problem has the highest priority? You see, they are linking the problems, okay, with the nursing diagnosis. If you are smart, you should be able to know. Okay, it's the same art pie that the old art pie you know is what they have changed. They have changed it, rephrased them. Okay, so which problem has the highest priority? Hmm. So you see how they use grammar. Okay. Yes. So if they give you these ones, you know that, oh, this is the diagnosis. This is the diagnosis. This is the what? Swallowing problem, weak cough. Okay. And what? Shallow respiration. Which problem has the highest priority? Is it imbalanced nutrition as a result of the shallowing, or impaired verbal communication, weak cough, okay, or impaired respiratory failure, impending respiratory failure, or activity intolerance? So everybody will choose C. Okay, good. Now let's go to question number 9. A client with gastrointestinal bleed has the following findings. Blood pressure is now 82/46. Heart rate is 128. Cool, clammy skin. Urine output in the space of 1 hour, he has only 15 mils. Hemoglobin is 7.1. Which hypothesis should the nurse prioritize? Mhm. So they will change. They will change grammar for you, but you should be able to relate and get your answer. Good. Let's go. Question number 9. Question number 9. Question number 9. Mhm. Hypotension, tachycardia, cool, clammy skin, low urine output, and hemoglobin of 7.1. Good. Yes, so this is a clear example of what? Hypovolemic shock. Okay. Yes. So you see how it is. If somebody with acute kidney injury, the urine output will be low, but that person will not have HB of 7.1. So you cancel it out. Somebody with anxiety, the heart rate will be high, okay, but you not have cool, clammy skin, so it will be out. Somebody has impaired skin integrity, okay, losing what? Heat, so the skin can be cold, but you not have an HB of this. So one of the answers will connect to all the options. That is it. But before you know that, you should be able to hot. So the first 3 is easy, and the last 3 is cheap. These ones, everybody will get 100/100 because we are going to plan. Before, when we are drawing care plan, if you look at the art pie on the planning, eh, we plan, we generate solutions, we bring out solutions to help the problem we have seen. But now they are not calling it planning again, they are saying generate solutions. So draw your plan, how you are going to do it. Okay, how you are going to do it. So we have done the assessment and we have done the diagnosing. Okay, let's do the planning. What can we do about the problem you have seen? You went and saw somebody on the floor, unconscious. What can you do about it? So the question asks you to plan intervention or identify expected outcome. How do you think we are going to do it? Okay, so we will say that, oh, let's go home tomorrow. When we come back, we will come and draw a care plan for this newly admitted patient. It's not, we don't always do it like that, but I'm just saying it like that. So whilst you are in the house, you are thinking about, how are we going to draw this care plan? How are we going to do this? How are we going to do this wound dressing? How are we going to? It is what you are anticipating how it will be done. What medication will this doctor prescribe for this patient? What medication do you think? Somebody has come with what? A potassium of 2.1. What medication do you think will be what prescribed for this patient? So if the doctor prescribes sodium bicarbonate, you question the doctor that, no, why are you prescribing sodium bicarbonate for potassium of 2.1? Yes. So this is what anticipation or planning issue. So some of the question phrases you will see, I don't have to run through all this. If you get a slide, you will know because we work with time. Okay. Which intervention should the nurse include in the plan? You have seen this over and over and over. Which action should the nurse anticipate? Which prescription should the nurse expect? Which interventions are appropriate? What should be included in the care plan? Which outcomes should the nurse expect? What blah blah blah. Get all these ones. Okay, so let's go to the key ones. What are we doing here? We are creating a list of possible solutions. You note, you have not necessarily performed the action yet. You are now writing down. As a patient comes, you sit at your nurse's station, then you draw a care plan. So on planning, what are you planning down? If the doctor should come rounds, what do you think laboratory investigations will be what ordered or prescribed? What investigation, what scans will be prescribed? Okay, a young female has come with what? Lower abdominal pain and having what? Vaginal bleeding. What do you anticipate will be done for this person in the nurse's way, in the doctor's way? Okay, this is what planning. You plan and you prepare. So, which intervention should the nurse anticipate for a client with what? Pulmonary edema. Select order apply. Then they will put it there. Okay. If the question asks, if the question asks you for several possible interventions like the SATA, yes, or a plan of care, anticipated prescription, expected outcomes, think about what? Generate solution, you plan it. Okay. And as you are planning, the nurse identifies and ranks the client's most likely or dangerous problems. Then you start the planning from there. Then I'm reading again. The nurse should always, as you are planning, identify the ranks, identify the most likely or dangerous problems, and start the planning from there. So you prioritize your airway breathing circulation, actual potential in all, AMASA. That's it. You are done. Sometimes they can give you one patient with multiple problems, or they can give you multiple patients with what? Single problems to choose from. So note that it's both sides of the coin. But if you know the concept and your foundation is good, that's it. So they can give you time sensitive complications. Somebody's blood pressure is what? 60/25. If you don't do anything about it, okay, this patient is going to die. Likelihood and urgency whilst we are planning, the safe risk, your life threatening conditions, the stable over the unstable, acute over the chronic, the ABC, you should prioritize them. Okay. So the question mostly asks which problem is most likely, most dangerous, and requires immediate intervention. For example, for the client with severe dyspnea and oxygen sat 86, impaired oxygenation is more urgent than anxiety or activity intolerance. Okay. Yes. So the nurse identifies appropriate interventions and expected outcomes for the priority problems. So in your solution, you always think about what solutions may include independence, nursing intervention, those in the care home. Yes. If the patient can feed themselves, that one will come as a priority. Prescribed treatment, monitoring, medication, diagnosis, client, depending on the case in front of you. Let's go and do some question. Okay. Question number 10. A client is experiencing acute pulmonary edema. Which intervention should the nurse anticipate? Select order apply. We are planning care for this patient. SATA. A client is experiencing ing. Remember the verb. It's a continuous verb. So it's still ongoing. Which intervention should the nurse anticipate? Question number 10. Should. Yes. Yes. Good. Number 10. Yes. Pulmonary edema, a lot of fluid in the lungs. What is your planning? How are you going to do it? Let's plan. Bible says, "Come, let us reason together. Let us plan." So God wants to plan with you. Okay, good. God is planning with you. Come, let us plan together. Let's reason together. Let's plan together. Let's plan together. Let's plan together. Oh, Caleb. Oh. I should preach on. Okay, let's answer because of time. Okay. Pulmonary edema, a lot of fluid. Okay. Position the patient in the semi-phalanx. Yes. Apply supplemental oxygen. Yes, because the lung fails. If you put the patient in this position, like this, semi-phalanx, it will be vertical like this. So the water will come and settle at the base. If you give oxygen, the oxygen will exchange at the top here and go. So it's a good plan. Encourage rapid oral fluids. Someone with pulmonary edema, you are going to add more water. No. So administer a prescribed loop diuretic Lasix. Okay. Lasix, good to drain the fluid out. Monitor oxygen saturation and respiratory status. Yes, is good. Okay. Then place the client flat with the legs elevated. They will die on you. So this is not good. Okay. Prepare for non-invasive positive pressure ventilation. Ambu bag, positive pressure, ambu bag, poo, poo, poo. Yes. Okay. So A, B, D, E, and what? G. As it. If your physiology is good, this one, okay. Yeah. Okay, let's go. Number 11. A client with diabetes has diaphoresis, tremors, blood glucose of 48. Which interventions are appropriate? SATA. So let all that apply. Diabetes, DM. He has this tremors. He has blood glucose, BG, 48. He has diaphoresis. Which intervention is appropriate? Yes, shoot. Say why and Forester, you're laughing at me. Yeah, shoot. Will you do A, B, C, D, whatever, whichever ones you do? Number 11. I need more answers. Shoot. Okay. So, yes, we will give sugar 15 grams or any cubes. Okay. Yes, you recheck their blood glucose in 15 minutes. That's good. Okay. Then C, administer rapid insulin. This is a clear sign of hypoglycemia. This one will kill the patient. No. Then repeat the carbohydrate if glucose remains below. Yes, if only they are conscious. Okay. Then give a long acting carbohydrate or carbohydrate or meal after recovery. Yes, you do. Then give a long act. Yeah, you do. Then restrict oral intake for 1 hour. No, it's not the best. So A, B, D, E. Yes, yes. Okay. Yeah. So these are the things you should know. Question number 12. A client receiving a blood transfusion develops chills, fever, and lower back pain. Which solutions should the nurse include in the care plan? Select order apply. 12. Shoot. Mhm. 12. I trust you. I believe you. 12. Question number 12. Yes. Okay. So question number 12. Okay. Blood transfusion. So transfusion reactions. So you stop the transfusion. That is first. Yes. IV access. Maintain it with new tubing and what? Normal saline. Good. To flush the system. Then C, restart the transfusion at a slower rate. No, that's not the best. Then D, notify the healthcare provider and blood bank. Yes. Then recheck the client's identification and blood product information. Yes, you do. Then send the blood bag and tubing, okay, according to the policy of the hospital. Yes, it's good. You take it back to the lab. Yeah, so these are the things you should know. Question number 5, okay, take action. Now we have reached implementation. Before they call it implementation. Now it's called take action. Okay, that's the last but one area. Then we say goodbye for today. Okay, yes. So take action. You ask yourself, what must I do now? So you see questions with phrases like, what should the nurse do first? Questions that will ask you to act. Okay, what is the nurse's immediate intervention or action? Which action should the nurse take? Okay, which intervention should the nurse implement first? Which prescription should the nurse implement first? Place the nursing action in the correct order. What should the nurse do next? Which action is the priority? Okay, so these are the things the nurse they will ask you. So over here, you are no longer planning. You are no longer planning all these several. Somebody is asking for link. Wow. Okay. Yes, you are no longer planning. Okay. Rather, okay. Rather, you are what? You are choosing the action to implement immediately. Okay. To implement immediately. To implement immediately. That's the most important thing. The actions to implement immediately. Okay. So example, a post-operative thyroidectomy client develops stridor. This is an airway emergency, upper airway. What should the nurse do first? Stridor, upper airway emergency. Okay. You take action. Okay. Because if you don't protect the airway, secretions alone can block it and cause issues. Ah. So when the question asks you some of these phrasal, put all these phrases in the question, they are talking about what? Do something, do it. The next, select and perform the safest. So always safety as the denominator and your action at the top. That's it. So all your action. Good. Can you hear me now, guys? Is it better? Let me know if you can hear me. Is it better now? Let me know if it's okay. Yes. Okay, let me share the screen. Okay, let's quickly finish the slides. Okay. Right. Okay. So question number 13. A client develops inspiratory stridor shortly after thyroid surgery. Okay. So which action should the nurse take first? Which action should the nurse take first? Which action should the nurse take first? Question number 13. Which action should the nurse take first? Jennifer, can you hear me now? Which action should the nurse take first? Good. So you activate the emergency assistance and prepare to maintain the airway. Okay, that is C14. A client receiving IV morphine is difficult to awaken. Okay, a client receiving IV morphine is difficult to, okay, 14. It's difficult to awaken. Okay. What action should the nurse take first? Okay. What action should the nurse take first? So, what action should the nurse take first? Good. So, as B, stop the opioid and support ventilation. Stop the opioid and support ventilation. Yes. Stop the opioid. Good. So implementations. Okay. Question number 15. A client with tracheostomy suddenly becomes restless. The oxygen saturation decreases from 96 to 84, and the nurse cannot hear airflow through the tube. Okay. Which action should the nurse take first? Question number 15. Which action should the nurse take first? Taking action. Yes. Taking action. Which action? Question number 15 is showing. You can hear airflow through the tube. Yes. Okay. So the last topic for the day is what? Evaluation. In the nursing process, everything you do, you evaluate. Okay. You evaluate everything you do. So you treat the patient, then you evaluate to see that the treatment has worked or not. You either go and talk to the patient can make a comment to help you to know if the discussion or education went well, okay? Or you can ask the patient a question, okay? You can redo a certain lab, let's say potassium, redo it, troponin, redo, okay? Yes. Or you can check the effectiveness of a certain medication, okay? Yeah. So what is going on? Can you hear me now? My mic is not muted. Please let me know if you can hear me now. Is it better now? Can you hear me? Okay. Right. So you evaluate every care you do, okay? Everything you do. They can ask you evaluation questions like which findings indicate treatment was effective? Okay. Which outcome demonstrates improvement? Which finding requires modification of the plan? Okay. Which findings indicate that the intervention was unsuccessful? So it's not every day that you get successful interventions. Sometimes interventions will be unsuccessful. Then which findings show that the client is responding to treatment? Then which outcomes requires additional intervention? Has the expected outcome been achieved? Which findings indicate deterioration? So all these ones are hot phrases, okay, that you should know. So what are they looking for? What are we doing here? We are comparing the client's condition before and after treatment. When those questions, they ask you to help you or to check whether you are able to compare the client's condition before and after treatment. So, example, a patient receiving IV furosemide, which finding best demonstrates improvement. These are a pure what evaluation outcome questions. So you look for these three parts. An intervention has been performed. In the question, you look for these three parts. Was there an intervention performed? The time they performed the intervention and now, has that time passed? Then if yes, then the client is what? They are asking for what? Reassessment to know if the intervention worked or not. Okay. So they will ask you for all these stuffs. Okay. Yes. What are some of the signs of improvement? Oxygen will rise up after giving oxygen. Respiratory rate will what? Decrease from tachy to what? Normal. Then dyspnea. Please, can you hear me? I don't know why, because all my mics are on. If you can't hear me, you leave, then you join. Okay. Jennifer, so yes, you leave, then you rejoin because a lot of people are saying they can hear me. I don't know why. Some too. You exit, then you rejoin again. Okay. Right. So dyspnea improves, crackles decreased, client becomes less restless, skin color improves. If the expected outcome is not achieved, the nurse returns to the earlier step and revises the plan, just like we have been doing it every day. Okay, right. Let's try solving some questions here on evaluation outcome. So questions like 16, the nurse administers IV furosemide to a client with pulmonary edema. Which findings best demonstrate that treatment has been effective? Treatment has been effective. Shoot. Number 16. Yes, Caleb, I'll address that when the class is over. Okay, good. Yes, there are plans to treat maternal and child. Okay, question number 16. Good. So 16, the way to know that the furosemide has worked is what? That B, oxygen saturation rises from 86 to 95 and dyspnea decreases. Okay. 17, a client with hypoglycemia receives 15 grams of oral glucose. 15 minutes later, the blood glucose level is 58 and the client remains diaphoretic. What should the nurse conclude? Okay, what should the nurse conclude? So, number 17, yeah, shoot. 15 minutes later, the blood glucose level is what? 58, and the client remains diaphoretic. What should the nurse conclude? Okay, 17. Yeah, shoot your answer. After 15 minutes of giving 15 grams of oral glucose for hypoglycemic patient, you should start seeing results. Okay. Okay. So the answer is C. The outcome has not been achieved. Number 18. Number 18. A client with sepsis receives IV fluid and antibiotics. Okay. Which findings indicate improvement? Indicate improvement. Select all that apply. 18. Select all that apply. Select all that apply. 18. Yes. 18. Select all that apply. Select all that apply. Yes. Okay, so let's analyze. I'm watching your answers. Let's analyze. Okay, so let's analyze. I'm watching your answers. Let's analyze. Right. So, a client with sepsis receives IV fluids and antibiotics. Which findings indicate improvement? Mean arterial pressure increases from 58 to 68. That is good. That's a positive sign. Okay. Yes, the map. It says that it shows that blood and oxygen are going to all the major organs. Okay. 60 to 100. Good. Then urine output increases to 35 liters per hour. That is also a positive sign, above 30 for every 1 hour. Okay. Lactate decreases from 4.6 to what? 2.1. Yes. So whilst the map increases and the cells are getting enough blood and fluid, lactate will be diluted, it will drop down. Okay. Yes. So cellular hot perfusion is ongoing. Okay. Then D, client becomes increasingly confused. This is not a clear sign that what treatment has what improved. The grammar says improved, the verb. Okay. Capillary refill improves from 5 seconds to 2 seconds. That is a good sign. Okay. Yes. Then oxygen saturation decreases from 98 to 88. That is a bad sign. Okay. So the answers are A, B, C, and E. Okay. A, B, C, and E. Okay. Guys, A, B, C, and E. A, B, C, and E. A, B, C, and E. Okay. A, B, C, and E. Right. So, guys, this is the end of what our physiological, clinical, our clinical judgment topic for today. Okay. Yes, the clinical judgment is very short. I told you that if you have your ATT, you can use 1 month and 2 months to what? To fly. Okay. So if I were you, those of you who don't, if you have your ATT, your focus should be on the curriculum. Make sure you capture it. You learn how to solve the question, then you build your physiology. Those of you who doesn't have their ATT who are starting journey, maybe from next week, I'm thinking of starting the whole journey again. So I will start with my physiologies. Okay, the system by system analysis. Okay, system by system analysis. The learn Mr. Rick. Aha. Then we do the special clinics. So we do the special clinics in the space of 4 months. We should finish everything. So when we finish everything, then you graduate to what? ATT. If you have your ATT, give yourself, when you get your ATT, give yourself a month or two. Okay, if your ATT is 6 months, give yourself like 4 months, not a rush. Nclex, Nclex certificate does not expire. So not why are you rushing? Don't rush to go and get. If you get it wrong, they will put it on your record that you failed Nclex. Okay, so don't rush. Get the concept. If you get a concept, you get your license or your certificate. You are through. You are gone. Okay, pass and pass it once, and understand. And if you pass two, don't leave the page. The ATT group they can exit you, but on the main page, don't leave there. Stay once a while. You join and refresh your memory, because Nclex is a lifestyle. Yes, those of you who wants to connect and chat, Okay, I sent questions. Only few people sent their answers, and it's past yesterday. So I told you that after 12 midnight, I'm not out. That I've not slept. I have been awake since 6 p.m. I was reading. Yes, I connected with most people on this page. So if you did not send your answers to me, then you are not part of the people I connected with. Victor and Tommy and yes, the other ladies, I connected 5, 10 minutes, 5, 10 minutes, 5, 10 minutes, and everybody was okay. Okay. So please, when we send the questions, try and do it. Try and do it. Okay. Try and do it. Oh, it's if you send it, I'm not marking it because it's past time. If if I don't do that, people will not take it serious. Yes. So you can send, but I will not mark it. Yeah, so that is it. So the next time when I send, because if I compromise the principles, people will also sleep over it. Okay. Yes. If today is your first time, you subscribe to the channel, you share, then you like let's like today's channel. Go and click on today's session, like it. Okay. Yes. Yes. Yes, I mark it. Sarah, I think I've marked everybody's own. So if you sent it, I know I've marked it. Yeah. So please like today's session. Click on the like. Okay. Click on the like. Stanley, that is not an excuse because you have your phone. The questions are on the phone. Okay. So you should have answered it and submitted it. Okay. Yes. Like it. Okay. Like it. Good. Yesterday we did not hold a class. Okay. We did not hold a class. Yeah. So please. So far so good. We've come far. This is my number +1 5 0 5. Oh, I'm now going to sleep. Oh, so I told you I've been awake the whole 12 hours. So if you want to connect my number, the our WhatsApp number is there. Okay, connect. Is it when Jesus Christ was giving the parable? See, when Jesus was giving the parable, when the bride came, the 10 virgins. Okay, so the 5 virgins said they went to town to buy fuel to light their lantern. That is what Stanley is trying to explain. Okay. Yeah, but you must go through the system and the system must shape you. Okay. Yes. Caleb. Yes, so yeah, I'm actually starting a new journey next week, Monday. Okay. So next week, Monday, I'm starting a new journey. Good. Thank you so much. Thank you so much. If you haven't liked the page, like and share. Okay. I can share. Okay. Let me leave you. Okay. So I'm sending the slide to the page. Prepare yourself. Tomorrow you are coming to answer tough questions for the 2 hours, 50 questions for the 2 hours. Okay. Prepare yourself tomorrow on this clinical judgment. So we are done with clinical judgment. Okay. We are done. We are done with physiological adaptation, ATT. We are done with psychological integrity. We are done. Okay. So take note. Okay. Yes. Basic care and comfort. We have done half. Let's leave it half. Today, class session, I will host the other half, the main class. Okay. So if you are able to get up early. Okay. Thank you. Yes, there's going to be meeting in the afternoon for the main page. Okay. We are going to continue on the basic care and comfort session 2. The basic care and comfort is so loaded. Jesus. I always feel lazy to teach that. It's so loaded. Okay. But let's try and finish. Okay. Basic care and comfort in the afternoon session. So if you want to grab that, come and grab it. Okay. Bye bye.